Care of normal baby at birth. Today we are going to learn about the care of normal baby at birth. Objectives. The objectives of this session are to describe the basic needs of a newborn at birth, to provide evidence-based care to a newborn, enumerate the components of clean chain and warm chain, and educate mother how to look after her baby and what to do if she is sick. Introduction. The first hour after birth has a major influence on the survival, future health and well-being of a newly born infant. The health workers have an important role at this time. The care they provide during this period to the baby is critical in helping to prevent complications and ensuring survival. All mothers need help, support and advice to take care of the newborn after delivery. Basic needs of a normal baby. Every newborn baby has 4 basic needs at the time of birth: warmth, normal breathing, mother's milk, and prevention of infection. These basic needs indicate that a baby's survival is totally dependent upon her mother and other caregivers. Therefore, it is important to provide proper care to all the newborns immediately after birth. Essential newborn care, including exclusive breastfeeding, keeping the baby close to the mother, reduces the risk of hypothermia and hypoglycemia, minimizes the risk of illness among newborns, and maximizes their growth and development. Care of normal newborn at the time of birth. There are few steps to be taken at the time of birth. They are: call out the time of birth. This is required for accurate recording of the time and, more importantly, alerts all personnel in case of any help needed. Baby should be delivered on a warm, clean towel and kept on mother's abdomen or chest. If this is not possible, baby should be kept in a clean, warm, safe place close to the mother. Immediately dry the baby, but if the secretions are present, suction first and then dry. This will prevent aspiration, as drying itself is a stimulation for a baby to breathe. At the time of drying itself, the baby's breathing should be assessed. Wipe both eyes with sterile swabs. Clamp and cut the umbilical cord after 1 minute using a sterile blade about 2 centimeters away from the skin. Leave the baby between the mother's breast to start skin-to-skin care and early initiation of breastfeeding. Cover the baby's head with cap and cover the mother and baby with a warm cloth. Place an identity label on baby's ankle or wrist. Encourage mother to initiate exclusive breastfeeding. Ensuring warmth using warm chain. Maintaining warm chain is the continuous process of providing warmth to the baby right from the time of delivery to till the time baby is discharged from the hospital. Warm chain at birth. Ensure the delivery room is warm and no draught. Temperature is between 25 to 28 degrees Celsius. Dry the baby immediately. Remove the wet cloth. Cover the baby with clean dry cloth. Keep the baby in skin-to-skin contact with mother on the chest. Postpone bathing or sponging for at least 24 hours. Warm chain after birth. Keep the baby clothed and wrapped with head covered. Avoid bathing baby in cool weather, and particularly for small babies. Keep the baby close to the mother. Use KMC for stable low birth weight babies. Show mother how to keep baby warm and continue breastfeeding. Helping baby to establish normal breathing. Assess baby's breathing while drying her. If baby is crying vigorously or breathing adequately, there is no need for any intervention. If baby is not breathing or gasping, provide skilled care in the form of initial steps and positive pressure ventilation, etc. Initiating breastfeeding. Most of the babies are ready to take feed within 30 minutes to 1 hour after birth. Provide skin-to-skin contact to the baby after birth. Help mother in feeding her baby. Ensure that both mother and baby are in comfortable position. Check attachment and positioning when the baby is breastfeeding. Do not give any liquid other than breast milk or colostrum. Prevention of infection. Clean chain. Before birth, babies are well secured in their mother's womb. After birth, they are to be protected from infection. Cleanliness at the time of delivery is required. Hand washing is the single most important step to be emphasized to both family members and the health workers. Clean chain is similar to warm chain, which was discussed earlier. At the time of delivery, clean chain is to be maintained. The clean chain consists of 6 cleans given by WHO, includes clean attendant's hands, clean delivery surface, clean cord cutting instrument, clean string to the cord, clean cloth to cover the baby, and clean cloth to cover the mother. Similarly, clean chain is to be maintained after delivery and continued till the time of discharge to protect the infant from infections. All caregivers should wash hands before handling the baby. Mother should breastfeed her baby. Cord should be kept clean and dry. Nothing should be applied on the cord. Clean absorbent cloth should be used as diaper or napkin, and mother should be told to wash her hands after changing the diaper or napkin. Cord care and eye care. Cord care and eye care are two important components of baby care. Cord care. For providing cord care, put the baby on mother's abdomen or chest or a warm, clean, dry surface close to the mother. Change gloves. If not possible, wash gloved hands. Put ties tightly around the cord at 2 cm and 5 cm from the abdomen. Cut the cord between the ties with a sterile instrument. Remove blood or meconium by wiping with clean cloth. Observe for oozing blood. If blood oozes, place a second tie between the skin and the first tie. Don't apply any substance to the stump. Leave stump exposed and nothing should be placed on it. If the stump is soiled, wash it with clean water and dry with a clean cloth. Remember, applying traditional remedies to the cord may lead to infection and tetanus. Eye care. There are certain do's and don'ts to be followed. Do's. Eye care is given to protect a baby's eyes from infection. Eyes should be wiped as soon as possible after birth. Both eyes should be gently wiped with separate sterile swabs soaked in warm saline water. Eye drops or ointments, whenever indicated, should be given within 1 hour of delivery, for example, in areas where sexually transmitted diseases are common and antimicrobial eye medicine should be applied. Do not apply anything else, for example, kajal in the eyes. Weigh the baby. Weighing helps identifying babies at high risk of death. Babies having weight less than 2,500 grams may require special care to prevent low body temperature. Less than 2,000 grams should receive prolonged skin-to-skin contact, and babies less than 1,500 grams will need referral to higher facility. Examine the baby. Count the number of breaths during 1 minute. Observe the movement of limbs when awake, and observe position and the tone of limbs when baby is asleep, not moving. Observe the skin color of the baby. Inspect the body areas for abnormalities like head, face, mouth, palate, chest, abdomen, genitalia, anus, limbs and skin. Features of well baby. A well baby is the one who maintains normal temperature, is warm to touch, pink with weight more than 2.5 kg. Well baby breathes easily at 40 to 60 breaths per minute. She moves her arms and legs equally when active and rests with limb flexed. Explain the mother the examination findings to allay her concern, document in case record and ask her to inform you in case if any other concern develops subsequently. Give injection vitamin K 1 mg to every newborn, 0.5 mg for newborn less than 1000 grams intramuscularly. Encourage mother to breastfeed their babies during injection for comforting the baby. Monitoring the baby. Monitor the baby during first hour after delivery every 15 minutes for breathing, temperature and color. Don't leave the mother and baby alone. Look for chest indrawing and fast breathing and listen for grunting. For temperature or warmth, check the feet of baby by touch method using the dorsum of your hand. Finally, evaluate the color of the trunk and extremities of the baby. Special situations and newborn care. Difficult deliveries such as cesarean section, instrumental delivery, breech delivery and newborn care in HIV are the special situations requiring special care. Difficult deliveries. Before delivery, make necessary arrangements for resuscitation. A baby delivered by LSES or instrumental or breech delivery should not be separated from the mother. Once the baby is born, monitor her in every 15 minutes. Begin breastfeeding as soon as mother is comfortable and respond to baby. Begin skin-to-skin contact and provide assistance to these mothers in positioning and attaching the baby. HIV and newborn care at birth. Care of a baby born to HIV positive mother is same as normal baby. Use HIV kit while delivering the baby. All HIV infected pregnant women should receive prevention of parent to child transmission interventions early in pregnancy. While delivering the baby, follow standard safety precautions. After birth, provide immediate skin-to-skin contact as any other mother and baby. Promote exclusive breastfeeding in first 6 months. If mother chooses replacement feeding, prepare formula feed. Ensure that it is affordable, safe and sustainable. These feeds should be given by cup, not by bottle. All other care, including cord care and eye care, remains the same. Give oral nevirapine for 6 weeks to neonate as per the national policy. Counsel the mother regarding the mode of feeding before delivery and dangers of mixed feeding. Finally, at the end, I would like to give you key messages of this session. The 4 basic needs at birth are warmth, normal breathing, breastfeeding and prevention of infection. Ensure warmth by skin-to-skin contact with mother's chest or abdomen. Help the mother to initiate early breastfeeding. Follow WHO 6 cleans to prevent infections in newborns. Thank you.